Hi, everyone. Welcome to today's web conference, Intersectional Justice and Safety from Sexual Violence, Spotlights from a New Report on Health Equity Strategies. This web conference is brought to you by Prevent Connect, a project of Valor US, as well as Prevention Institute and the National Sexual Violence Resource Center. Prevent Connect is a national project of Valor US, sponsored by the US Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views US government, CDC, or Valor US. And now I am super excited to take a break, take a drink of water, and let the Prevention Institute team guide you all on the web conference today.
Thank you, Tori, and hello, community, beautiful 265-person Prevent Connect community. My name is Lisa Fugia Parks. My pronouns are she, her, hers. I'm zooming in from Oakland, California, Ohlone Lands, and I'm delighted to be here with you today with my wonderful colleagues, Will Crary and Zachary Tarot, who have worked hard to prepare for today's web conference. And you will get to hear from Will and experience Zach more behind the scenes, but I'm incredibly grateful to both of them, who are just fabulous teammates to work with. And we are all from Prevention Institute. And we have a couple of objectives set out for our web conference today. This web conference is part of a putting out into the world a paper that we collaborated with the National Sexual Violence Resource Center on, and that is about health equity strategies to addressing sexual violence. So one of our objectives is to describe the 5 strategies that we lift up in that paper. We're also going to take short pauses to make the connection between what we lift up in that paper and CDC's technical packages, which are also wonderful resources. We're going to hear from speakers who are highlighted in the paper, who are going to share about their work that we're describing as intersectional justice and safety work, this health equity approach that really brings an intersectional perspective to work on justice and safety. And we're going to highlight strategies focused on shifting internal organizational practices, as well as specifically a campaign that's focused on eliminating dependency on tipped wages as a intersectional strategy for preventing sexual violence. Super excited to hear about that. And we're going to have plenty of discussion time with our speakers and with you all to talk about what you can do within your organizations, how you can get involved in the campaign that's being led by One Fair Wage that you're going to get to hear about today. So that's what we're going to do in the next hour and a half. And because this is a discussion, we really want to hear from you. So let's kick it off with another question for you, this time in the form of a chat question. The paper talks about health equity strategies. Would love to hear from you in the text box. That's what it's called, text chat box. What does health equity mean to you as we start this conversation on health equity strategies for sexual violence prevention? What does that evoke for you? What does that mean to you? Please take a moment to put your responses in the chat. And while you're doing that, we're going to bring in our dear colleague, Jen Grove from the National Sexual Violence Resource Center, who can share her thoughts on health equity strategies and why they're so important for our work to prevent sexual violence. So Jen is the prevention director at NSVRC. I've really been honored to have the chance to work with you, Jen, on a number of projects over a number of years. So thank you so much for the opportunity to work with you on this paper and on this web conference, and we'd love to hear your thoughts.
Thank you, Lisa. I'm loving all the answers, scrolling here through the chat. Thanks for the introduction, Lisa. And yes, I'm Jen. I use the pronoun she, her, and I am joining you today from Harrisburg, Pennsylvania, which is where the National Sexual Violence Resource Center is headquartered, from the land of the Susquehannock. And I am thrilled to be here. I have to say, this is a resource that we have been thinking about for a really long time, and the universe just gifted us with this opportunity to work with Lisa and everyone at Prevention Institute on this document, and we could not be more thrilled to be able to do that. Yeah, so I'm happy to be here. I'm happy to be having this conversation, and I will say that, so the National Sexual Violence Resource Center is, one thing I always like to say is we are your resource center. We are a resource hub for you for information, for research, for trainings. We have podcasts. I'm going to put our podcast link in when I'm done talking, because I love our podcast. It's a chance that we've been able to have. We started these right at the beginning of COVID times, as we call them. And we have learned so many wonderful things from the guests in our podcast. We have blogs, lots of other resources. We always say, you name it, we probably have it, or at least know somebody who has it. So that's one thing I really want to get across today, is that we are your resource hub. Please, if you're looking, if you're working to build healthy and safe communities free from sexual violence, we want to help you by providing those resources that you need to do that. So with this paper, A Health Equity Approach to Preventing Sexual Violence, we wanted to help bridge a gap that we saw, to help people see the connection between health equity and our work to prevent sexual harassment, abuse, and assault. So in doing this, when we're looking at health equity, and some of you have said this, we really, it's really requiring us to recognize oppression and systemic abuses of power as root causes of violence, and then figuring out how do we work to address those issues, as well as reach the people in the communities that are most impacted and change those larger systems. And so I am so excited that we got the chance to do this resource with Prevention Institute, and the programs that we reached out to and stepped up and said, we're excited to share what we're doing. We are so excited to be able to have those programs highlighted in this. So I just want to thank our partners at Prevention Institute for their work on this resource and their continued strong partnership with us at the Resource Center, and our partners at Prevent Connect. I have said this numerous times. I am so glad in these times that we've had with Zoom. I know a lot of people are fatigued, but I am always so grateful to have Tori and Ashley and everyone at Valor and Prevent Connect being so willing to jump in and say, we'll host this for you, we'll do this, because that piece of the technology is just beyond me. So I am so excited and happy to have our partners hosting this web conference. And also, as I said, the amazing programs that are highlighted and spotlighted in the document. And to all those program staff who are doing great work in making the connection between health equity and sexual violence prevention as well. So I know we're going to dive more into that, but I just wanted to say thank you. Glad you're all here, and I'm excited to learn along with all of you as well.
Wonderful. Thank you, Jen. Really appreciate the opportunity and the partnership, and what a great way to describe the need for this paper as filling a gap. So I'm going to offer a definition of health equity that we put in the paper, and then I'm going to turn to Will to ask to see what folks are describing in the chat, because it is a really big topic with many, many dimensions. So everyone's thoughts and perspectives is going to create a richer understanding of this topic. The definition that we offer in the paper is that health equity means that everyone has a fair and just opportunity to attain their full health potential, and that no one is disadvantaged, excluded, or dismissed from achieving this potential. And that's a very public health driven definition. I want to acknowledge it builds on the thinking and evolution of health equity work from multiple sources. And in terms of making the connection to sexual violence prevention, in order to really have the fair and just opportunity to attain one's health potential, that would include freedom from violence, freedom from multiple forms of violence, including gender-based violence and other forms of systemic violence, and oppression. So to me, preventing sexual violence is such a key part of achieving health equity. And we include another quote in the publication that I wanted to lift up today from one of my favorite thinkers, musicians, and authors, Lila June, who is an Indigenous environmental scientist, community organizer, and musician of multiracial, Indigenous, and European heritages. And I really appreciate the work that she does to really lift up the issue of rape and sexual violence and the importance of addressing it. She says that rape is fundamental to the problems we see in the world. I would put it as the highest priority for us to address, because this is where the root of life breaks down and is passed on intergenerationally. So encourage folks to look into her work. She's a brilliant organizer and thinker and musician, and really underscores for me the enormity and fundamental nature and importance of addressing rape and sexual violence to health equity and other issues and challenges that we face in the world today. So with that kind of overarching, frame around why this paper, I want to just talk really briefly about the 5 strategies that we lift up in the paper. And there are many, many other components to advancing health equity and sexual violence prevention. These are the 5 that we landed on to highlight in this paper. The first is to elevate community leadership and community resilience. The second is to make sure that we are attending to both healing and prevention when we are doing our prevention and health equity work. The third is to make sure that we are doing our own internal organizational change as part of the work. The fourth is to then address the underlying factors that contribute to violence and that contribute to safety, making sure that we're getting to those root causes. And in order to do that, partnering across fields and movements, because the underlying factors that contribute to sexual violence are enormous, and we have to build a large and intersectional movement to achieve this. So please, I hope you will check out the publication and reflect on these 5 strategies. We also in the paper make the connection to the CDC's technical packages. They're also really wonderful resources that identify a number of different strategies and provide evidence and research on why those strategies are effective. And we'll pause to make those connections briefly throughout the conversation today. And as Jen mentioned, there are lots of wonderful organizations spotlighted in the paper. Here are the beautiful logos of all of the organizations: the New Jersey Department of Children and Families, Multicultural Efforts to End Sexual Assault, Visioning Bear Circle, Intertribal Coalition, Black Women's Blueprint, Michigan Coalition to End Domestic and Sexual Violence, Oregon Coalition Against Domestic and Sexual Violence, Colorado Department of Public Health, Bloomington Inclusion Collaborative, One Fair Wage, and the Alaska Network on Domestic Violence and Sexual Assault. Yay! And we'll get to hear from a few of those great folks today. So I want to come back to you all again, having just briefly heard the 5 strategies very briefly described. I want to ask you, we're going to launch another poll. Which are the strategies that resonate as being most important to health equity for you right now? And you have the opportunity to select all of them, but I want to encourage you to maybe pick 1 or 2 that really rise to the top for you as being the most important. So thank you. I can see that folks are voting. Please continue to vote, and we'll see where folks land. I love this live interactive engagement where we get to hear the thinking reflections of so many of you so quickly, and have technology support our making sense of it so quickly. So it looks like more than half of the folks have voted. More votes are coming in. Right now we have 70% folks indicating that addressing underlying factors that contribute to violence is most important. And then we have kind of a tie between creating spaces for healing and prevention and partnering across fields and movements. And then next is elevating community leadership and resilience, and then facilitating organizational change. But we'll Okay, voting has slowed down, so I think we can go ahead and end the poll. So that's really, really interesting. I will want to hear more from all of you as we proceed on why those strategies are so important and how we can continue to support each other's work in those areas as today and beyond. So without further ado, I want to turn it over to my dear colleague, Will, who's going to facilitate the conversation from here.
All right, thank you, Lisa. And it's so nice to join all of you in this space today. If you're like me, looking at that poll, trying to just select one is so challenging. And what I'm really excited about in conversation with our guest speakers today is to see how those different strategies are overlapping. So without further ado, you see on your screen our two guest speakers for today. And first, we'd like to welcome Shamila Ruiz, the Communications Director at One Fair Wage. One Fair Wage is a national organization committed to improving wages and working conditions in the service sector, which Shamila is going to describe in greater and more graceful detail than I can. And while Shamila and I discuss One Fair Wage's contributions to a health equity approach to preventing sexual violence, we welcome all of our participants to put questions and comments in the chat to keep it as engaging as possible. So I invite Shamila to turn on her video and unmute herself. And just wanted to start with thanking you so much for joining us, Shamila, and wanted to hear a little bit about what One Fair Wage is and how you personally came to be involved in this work.
Yeah, can you hear me okay?
Perfect.
Great. Hi, everybody. Good afternoon to those of you on the East Coast. Good morning to the West Coasters. My name is Shamila Ruiz. My pronouns are she, hers, and I'm based just north of Boston in occupied Namkeg land of the Massachusetts Pawtucket tribe. As Will just mentioned, I'm the communications director at One Fair Wage. We're a national organization, campaign, and coalition representing over 250,000 service industry workers and 1,000 small business restaurant owners, progressive restaurant owners who are calling for a full livable wage with tips on top. We've been working for the past 2 decades really to win a fair minimum wage for all workers in the United States, to lift millions of tipped and sub-minimum wage service industry workers across the country out of poverty, empower these workers through political education and civic engagement, and most related to this webinar, work towards greater racial equity and reducing sexual harassment and gender-based violence against women at work. The One Fair Wage campaign actually grew out of the Restaurant Opportunity Centers United, which is a national nonprofit and worker center working to improve wages and working conditions in the restaurant industry specifically, but we've since expanded our campaign and coalition to include other industries for which tips are considered wage replacement, like nail salon workers, some airport wheelchair attendants, car wash workers, as well as incarcerated workers and differently abled workers with disabilities. Now, we're not a traditional social service agency. We, push for national policy to eradicate the subminimum wage, which is a direct legacy of slavery and has a strong correlation to high rates of sexual harassment against women at work for those women who have to rely on tips, have to rely on the whims of customers. It's a primarily female workforce. Over 70% of tipped workers in the restaurant industry specifically identify as women. And as I mentioned, there's a direct correlation between fair wages, relying on tips, and sexual harassment at work. Like many women, the service industry was my first job. I started my career in the restaurant industry, so I'm proud to be able to advocate for restaurant workers today. Like many young women, it was my first experience in the workforce. So when you go to work in a traditionally very problematic industry that's known for all sorts of abuses against immigrants, people of color, women, that kind of sets a tone for many women's careers throughout their lifetime. We've had presentations where we've presented and had judges to attorneys to doctors saying, I experienced sexual harassment later in my career, but it was never as bad as when I worked in the restaurant industry. So I didn't really categorize that as sexual harassment. So as Tori mentioned before, a lot of this work is prevention and creating policy-wide changes that are proven to improve sexual harassment, to minimize sexual harassment, improve conditions against women at work, and really get to the root causes of these racial and gender disparities that we see. So we are honored to be featured in the report. I'm honored to join you all and dive a little bit deeper in our work and how it relates. But again, really happy to be here. Will, your next question.
That was perfect. Thank you so much, Shamila. And I think just hearing you get to talk about like how you expanded beyond restaurants, this diverse community of workers. And I know if we pose the question in the chat, a lot of people would share this experience of service industry. And so just grateful for you sharing that piece of your own history.
Always curious to hear of, 300 folks, how many have worked in the service industry or have worked for tips in their lifetime?
Absolutely. Informal poll in the chat if you're willing to share, folks. So something so powerful about the movement for one fair wage is that, as you just described, you all ground your strategies and recommendations in lived experiences and the stories from working class tipped employees. Oh my goodness. And I just see in the corner of my eyes, the chat is lighting up right now. So I'm excited to check that out. Shamila, can you share a little bit about the surveys your organization conducted and how data links tipped wages with sexual harassment?
Sure. Prior to the pandemic, like I mentioned, tipped service work was difficult work. Over 70% of women who comprise the tipped workforce in restaurants specifically, and many of them through our research over the last 2 decades and our work with organizations like Futures Without Violence and Ultraviolet and other women's groups have reported experiencing extreme sexual harassment, and things have just gotten worse since the pandemic. It's, as you know, created a crisis for service industry workers and employers who have had to, shift so many times accordingly. Thousands of restaurants have closed, as we read, and nearly 10 million tipped workers at the height of the pandemic lost their jobs. Many workers weren't able to access unemployment insurance. And as our research found, customer hostility and harassment got so much worse with the pandemic. In December of 2020, we conducted a research report entitled "Take Your Mask Off So I Know How Much to Tip You." And we published 16 pages of comments of over 2,600 surveys of women's experiences during the pandemic, with comments like, take off your mask so I know how much to tip you. How can I ever know how much to tip you if I can't see how cute you are, and, adjust my tip accordingly. And this was, like I said, almost 3,000 women who submitted their experiences to us, who had an overwhelming experience of increased sexual harassment, hostility, having to enforce mask mandates against the very same customers. So all of a sudden they went from being service industry professionals to having to enforce health and safety mandates. Sorry, I'm going to have some background noise in just a minute. Get my dog coming back from the dog walkers. So sorry if you hear some background noise, I'll go on mute if necessary. But as I mentioned, this was a very unique experience to the service industry. And while some other retail sectors have had similar experiences with customer hostility and harassment, it was one of the only industries whose entirety of their wages, the federal subminimum wage in the United States, is $2.13 an hour in many states. In my home state of Massachusetts, it's $5.55 an hour. That number varies. California, actually, where you all are based, is one of the few states, 7 states in the nation, that has one fair wage and has eliminated the separate subminimum wage for tipped workers, meaning workers don't have to rely on tips, many decades ago. Our mission is to make sure that the remaining 43 states get to the same place as California and the entire West Coast. And so, as I mentioned, in the Take Your Mask Off report, we found just horrifying firsthand accounts from women of their experiences from the pandemic and having to rely on wages, on tips for the entirety of their wages. That was a research study that was conducted with partners, which found, as we know, that food service workers are at a higher risk of contracting COVID-19. Restaurant workers didn't have adequate protection from COVID-19. Tips have declined significantly, making service workers hesitant to enforce these mask mandates, and that many workers had reported, as I mentioned, a dramatic increase in sexual harassment from customers. You can read the full report. I'm happy to drop it in the chat at bit.ly/OFW COVID report. But that report single-handedly got the most press hits we've had in the history of our campaign, from the New York Times, the Washington Post, reporting on service workers' experiences of health and harassment during COVID.
Wow. And I want to say, I remember you mentioning that you were able to use data to demonstrate that one fair wage legislation is associated with a reduction in sexual harassment. Can you share more about that?
Yeah, that's correct. Sorry, I jumped ahead to the Take Your Mask Off report, but
Oh,
overall, we've seen from our research, through conducting research over the years about the rates of sexual harassment in one fair wage states, like I mentioned, California and the entire West Coast have, and 4 other states have had one fair wage for many years, and the 43 states whose workers earn sub-minimum wages, or who are paid sub-minimum wages, we should say, there's a direct correlation. So sexual harassment we found in the one fair wage states is cut in half when workers are made whole and paid that full fair wage. So it's a proven policy solution to pay fair wages as a way of reducing sexual harassment and gender-based violence against women at work.
Amazing. And I know that what came into the poll was that most folks kind of associated that strategy around addressing underlying factors that contribute to violence and safety with the outcomes that we want to see. And so it's helpful to hear you talk about that. But in the report, A Health Equity Approach to Preventing Sexual Violence, we specifically highlighted your work that exemplifies the strategy of partnering across fields and movements. So if you can kind of shift the discussion a little bit, I'd love to hear how One Fair Wage has brought together the organized labor movement and the gender justice movement. And while Shamila is responding to that, we invite our participants to answer the chat question being sent by Tori right now, just to keep your ideas percolating.
Great. Sorry, I was having a little bit of a difficulty coming off of mute. So yeah, overall, the labor movement has shifted, of course, in the last few decades, as we've seen workers shifting from traditional unionized work to greater prevalence and need for grassroots organizations, community-based organizations, worker centers. So over the last few years, of our campaign, and really the last few decades that we've been doing our work, we've been partnering with non-traditional labor movement organizations like grassroots groups and worker centers, and those advocating for gender justice and racial justice in our communities. We have 16 states that we've introduced legislation over the last few years for one fair wage, and a handful of states that we really consider to be key campaign states where we're really close. We've either passed one fair wage, or we're very close to either getting it on the ballot or moving it through the state legislature. Those states include New York, Michigan, Washington, the District of Columbia, Massachusetts, where I live, Pennsylvania. We've introduced legislation in Colorado, and in New Hampshire, and in Maine. And so as we continue our work, it's really important that we broaden our coalition to not just those, traditionally those groups that by the public perception have been pushing for fair wages, like labor unions, and over the last decade, the Fight for 15. But expanding our definition of who our close allies are to include those groups fighting for liberation for all sorts of oppressed communities, like women, BIPOC workers, and LGBTQ workers, and immigrant workers.
Yeah, it's so helpful to hear you kind of frame it as broadening the coalition beyond traditional stakeholders. And in the chat, I'm totally seeing so many of those come in. We'll review some of them, but I saw disability justice, music industry, whatever local sectors might be prevalent in our regions. And so really helpful to see that. So I'm wondering, Shamila, how has partnering across fields and movements actually strengthened the work that you all are doing, not just building your coalition, but what comes of that coalition?
Yeah, that's a great question. So as I mentioned, partnerships are a key strategy to uplift, not just one fair wage alone, but other kind of initiatives locally to uplift women's rights, anti-violence groups, anti-violence legislation. A really, really good example of this is actually a very recent example. Just last week, with a coalition of women's groups and over 150 grassroots organizations and notable individuals like Rosie O'Donnell in New York, we push for a broad agenda that includes a lot of anti-sexual harassment prevention legislation and victim advocacy work and one fair wage, as a progressive agenda that we're asking now Governor Hochul to take on, because sexual harassment really was the thing that put her into office in the first place. For those of you who don't know, Governor Hochul has taken over for ex-Governor Cuomo, who resigned due to sexual harassment allegations. So we're saying we need you to have a progressive and bold and forward-thinking stance towards protecting women in the New York workforce, New York women workers and women identifying workers. So we're calling on her to adopt this legislation. So that's just one example of how we've worked with grassroots organizations to advance policy, broad policy initiatives. Also, Representative Ayanna Pressley, my home congresswoman here in Massachusetts, has included one fair wage as part of her broad sexual harassment agenda in Congress. And so again, an example how including workers' rights and wage legislation in broader sexual harassment agenda has really taken off in the last few years in a way that we haven't seen before. And one last kind of partnership that's really important to know, and I think might be of interest to you all because it's growing and it's spreading. We created a program called High Road Kitchens throughout the pandemic, which is a project of our Small Business Employer Association called Raise High Road Restaurants, and was conceived in response to COVID to address three major challenges facing our communities. First, to help support, highlight, and uplift small business restaurants who commit to high road employment practices, which take the form of increased wages, improving working conditions, commitment to gender and racial equity in the industry as a whole, and committing to anti-sexual harassment trainings for their staff. High Road Kitchens also helps restaurant workers who have been laid off, furloughed, or had their hours significantly decrease the crisis, and helps feed people who are food insecure. So it's kind of a win-win-win. And we've run successful programs in California, New York City, Boston, Chicago, Detroit, and we're thrilled to be launching it in West Virginia this week. So we've been able to provide employers who are taking the high road to profitability by adjusting their business practices to make for a more holistic, safe, and equitable workforce for their staff. So High Road Kitchens, the New York Bold Agenda, Ayanna Pressley's comprehensive anti-sexual harassment legislation. These are just some examples that we've been able to push policy or programs through our coalitions and strategic partnerships with municipal government, state government, and federal government.
Amazing. If you are like me in the chat and wondering if this information is going to be recorded and shared, the answer is absolutely yes. I will definitely be going back to revisit some of the amazing knowledge that Shamila just dropped for all of us. In summary, it was really helpful to hear how this broadened coalition strengthens the impact of collectively advocating, and it kind of gives you this critical mass to be bold and to demand change. So thank you for sharing that. So really, in summary on this next slide, we just wanted to highlight for everyone that One Fair Wages work aligns closely with strategies outlined in specifically these two CDC technical packages that we can share the link in the chat for. And we're looking at strengthening economic supports for women and families, as well as establishing and consistently applying workplace policies. So just a reminder that these resources offer, actionable guidance for implementing change. And we're so grateful that we can chat with One Fair Wage to bring these strategies to life. And I think we're at the part of the show where I'm going to turn to Tori just to see what's coming up in the chat. And we're going to pose another question in the chat as well. So, Tori, any questions for Shamila that we're seeing, or comments that you were wanting to uplift?
Shamila, I thank you so much for sharing all of that. I think you inspired a lot of folks, especially in response to this question, as folks were thinking about it and replying in the chat of what industries or what movements they want to partner with. I thought it was really interesting that some of the first responses were related to entertainment and recreation, about community theater, local music scene in Nashville, folks working with disability justice, and folks hoping to work with environmental justice too. So just really want to thank you for the inspiration that you brought out amongst our audience.
And I just wanted to mention that's a great example of the kind of ever-facing face of labor that we seek to define and be inclusive of as part of one fair wage. So as you mentioned, musicians live off of tips, differently abled workers also earn a sub-minimum wage, and increasingly so gig economy workers. That was just one industry that wasn't mentioned. There's a whole lot more, but gig economy workers, you might not realize, also earn sub-minimum wages. So thank you for flagging that, because I wanted the opportunity to expand a little bit more, that there's so many workers that we don't realize earn sub-minimum wages in America.
Of course, yeah, and that kind of blew my mind too when you said that there were only 7 states that had implemented a one fair wage, and it made me grateful that I've spent most of my life in at least 2 of those states. And I do also want to uplift, folks are talking about some other community organizations that they are partnering with or are considering partnering with, like faith-based organizations, folks who are working with local queer and trans specific organizations too, which Shamila, you had mentioned about the disparities in pay and the impact of tip minimum wage on that too. So I think that pretty much covers everything I saw coming up in the chat. Ashley, I don't know if there were any other gems that you wanted to highlight too.
No, Tori, I think you got it.
Well, thank you so much for the opportunity to lift up our work and make that connection for folks about how wages and sexual harassment are really correlated, and an opportunity to do better as we rethink our economy post-COVID, or I don't even know if I should be saying post-COVID, but as we think about a revitalized economy, to make sure that we're including worker protections that are inclusive and protecting women and those most vulnerable in the workforce.
Absolutely. Well, thank you so much, Shamila. And we'll come back to you again later in the web conference to hear more about what's coming next and how folks can get involved. So stick around, everyone. Not the last you'll hear from Shamila. We're going to transition to our next guest speaker right now. I want to give a warm welcome to Lisa Winchell Caldwell, the Deputy Director of the Michigan Coalition to End Domestic and Sexual Violence. And the coalition is dedicated to developing and promoting efforts aimed at the elimination of all domestic and sexual violence in Michigan. So Lisa, I invite you to turn your video on and unmute yourself. Just again, a welcome and a big thank you for joining. To start, I was wondering if you could just tell us about the Michigan Coalition and your organization's journey into intersectional justice.
Absolutely. Thank you so much. I am joining from mid-Michigan, and so I will be sharing a little bit about the history of the coalition, but also wanted to follow suit of my wonderful presenters who went before me and share that I use she, her pronouns, and that I'm located in what was traditionally Potawatomi lands. And so I dropped some links in there for folks who want to know more about our sibling coalition and our tribal services that serve those areas. And then in terms of our relationship and our mission and our intersectional work, obviously that's a component of it. And we have some other things that showed up in this wonderful report that we are working on that we wanted to talk about. So our transition into intersectionality and moving in that direction was historically, like lots of our sibling organizations, our history with prevention is that prevention work was incredibly siloed. It was one department separate from everything else. And when our executive director, Sarah Potrenny, joined the organization, we moved in a direction where we brought everything together in this conversation around systems change and intersectionality work that was happening already in our prevention space, talking about the history of critical race theory, BIPOC identified feminists and womanist scholars and their work around this, and how prevalent that was in our prevention work, and wanting to really integrate this work into the conversation around how we're doing our intervention work, our systems change work, and supporting our member programs. So we worked with our board and some of our funders to adopt what we identify as the Great Lakes model, which is a model that centers in all presentations, all funding applications, kind of every component of the work that we do at the coalition, a model that looks at being survivor-centered, intersectional, and trauma-informed, and how we design every component of our work, from how we collaborate with one another internally, to what funding we pursue, to how we support our membership through technical assistance and training.
Amazing. Yeah, I think it's so helpful to hear you say that prevention and elimination of domestic and sexual violence are the broad goal, the end goal. And so it needs to be woven throughout the work. And just to have that kind of affirmed is so important. I wanted to just kind of highlight, like I did with Shamila, that your organization implements numerous strategies outlined in the CDC technical packages, like promoting social norms that protect against violence. And what we wanted to talk about today, something so special about the Coalition to End Domestic and Sexual Violence, is that you all don't just advocate for these strategies, you actually bring them home. And so over the last several years, what has it looked like to facilitate internal organizational change for health equity, and not just health equity, but economic and racial justice in your organization as well? And while Lisa's answering that, sorry to interject, Lisa, we're going to drop a similar question into the chat for folks to chew on.
Absolutely. I knew that question was coming. I think part of what I want to say in terms of what it looks like is that it is really some of the most incredible work that we do internally, in terms of being able to really support our member programs, our collaborative partners in doing deep and sustainable work, in understanding and being able to walk them through parts that do not go smoothly and the components that are not well ironed out. We are constantly learning and growing from how to effectively bring this work into our policies and procedures, to how it impacts supervision, to how it impacts the provision of benefits, all of these elements. One of my colleagues actually just texted me a minute ago saying, in the land of room for improvement, it's limitless capacity to do better, even when we are radically improving our work. And so making sure that we are having these conversations in ways where we're doing the same work and we can be side by side with our sibling programs, our member programs, our collaborative partners, and saying this is really challenging work. If it's easy work to do justice-based work, then we wouldn't have the challenges that we have. And I think there's a veering away when things get sticky or challenging. It took us several processes and attempts to have our board and our funders all in line to approve time off for our part-time staff, that they have prorated access to PTO based on the hours worked, so that we have multiple groups of people who work part-time at our organization. Some work more than others, and making sure that it was equitable across those staff and that everyone had access to a bank of PTO for when they were unwell or needed personal time, needed to rest and restore, and that there wouldn't be any questions or challenges about part-time staff's access to that. Was a long process, is just one example. And being able to walk other member programs and collaborative partners through what it looks like to have to make multiple asks, to hear the feedback about why folks are maybe in opposition, don't think it's effective or the best strategy, and being able to come back to that conversation has been a really integral part of the work. And we couldn't have done it without some of the staff that are working internally really hard for those conversations.
And I think on the next slide, we highlighted the Umoja work group. Can you share a little bit about what that work group is and what changes you've seen because of that work group?
Absolutely. That's exactly what I wanted. That space is one of the things that has come out of this internal work, is a space that is primarily focused on anti-oppression work and is being led in a shared leadership model by staff. Executive staff are not participatory in that space, and they are working on areas of anti-oppression work both internally. They are the group that brought back a request for paid time off for all staff. And their request, the way it was phrased, the research and effort that went into it, is what finally got that through our board and our funders in ways that executive staff hadn't been able to accomplish without them. They look at all kinds of things for our membership. They produce really incredible products. And it is focused first and foremost on a racial justice space, but really looking at an anti-oppression lens because of the nature of how all of the forms of violence are interconnected and mutually reinforcing, and how often when we do things in a less intersectional way, folks who have multiply marginalized identities are forced to choose. Which work group are they going to be a part of? Which systemic change process do they want to work on? Which toolkit is most impactful for them, or do they bring the most knowledge and passion to? And really wanting to create a space that doesn't shy away from racial justice conversations, but where it's not also siloed from other conversations about other forms of violence, like ableism, anti-queer community sentiments, heterosexism, ageism, and they have really incredible conversations about how that impacts things. And they've built a really fantastic tool last year that they released on self-care. I think that we will be dropping that link later in this conversation. As another really excellent thing that they've provided, they do Community Care Corner as a regular service in the membership for folks who are in an allied position or folks who are experiencing harm, challenges, oppression, and other forms of violence within their communities, within doing this work, systemic harm, as well as just burnout, compassion fatigue. They have different conversations in that space that are supported and facilitated. They look for themes, they bring back suggestions on tools and resources we can create and other things we can offer the field around that, including tailored technical assistance for member programs on concepts that are coming up in that space where we can do better as a field.
Thank you. And I see, just to highlight on this slide here, maybe there's something poetic about it, but the Emoja group is supporting you all with this internal change. On the other side of the slide, we're seeing external advocacy that you all are doing about groups who benefit from paid leave policies. And then this theme of bringing that work home, it's just so helpful to hear about the paid time off that you all have been working towards. And I'm wondering if you can share a little bit more about how else these changes have been implemented in your organization and what that has led to.
Yes, absolutely. So one of the major changes that we started working on about 5 years ago and have worked on in tandem and accelerated in collaboration with the members of our staff who are participating in Emoja and some of our board members is looking at pay equity. We did internal work around increasing our rate of pay by looking at Michigan's sustainable and equitable wage reports, things like ALICE wages, lots of things looking at what we thought were wages that people could actually live off of and met the fair standards for Michigan for a fair and equitable wage for the type of work that we're doing. And we adjusted our wages over a multi-year process to come in line with that, including building tools for making sure people's lived experiences are part of what we consider when folks are hired in, rather than only adjusting for things like formal education. Experiences with systems, experiences with lived environments are also things that are considered in determining wages and how starting wage as well as adjustments in wages are given across the course of people's tenure with us. It's something that we share with folks across our membership, and I've shared it with some of our sibling coalitions, walked through our process of creating it and drafting it. And it's something that we've been supporting our member programs and their boards in implementing and sharing it with funders in terms of what people should actually be paying for sustainable work and this level of emotional labor, and adjusting people's understanding that emotional and mental labor are real labor and they deserve to be compensated equitably, and that there are real impacts to not doing that. Our movement had a model that really started on folks being able to do this work because they had a partner who was working at a different job, who had benefits and a certain amount of income. I've heard everything from side money to pin money when I started in this work 20 something years ago, and making sure that we have a conversation around who that leaves out, who doesn't get to do this work when we can't provide a full wage. The field has increased over the time that we've done this. So being in a space where we've been able to, our wage now is at $20 an hour and for our starting wages at our organization, and the field has moved from an average of, I think, 14, they were sitting between 12 and 14, depending on what we looked at. They're now up around $16 to $18 for most of our member programs. And so really looking at how that conversation and the leadership for it was really important. Normalizing and pushing those conversations with funders and their boards were really essential. And the tools provided by Umoja were incredibly important and useful in the movement that we saw happen with member programs and their boards to look at the differential impact on folks and people that couldn't do this work and the ways that we couldn't have authentic diversity without really considering what our pay scales were doing for inclusion in this field.
Thank you for sharing that. And I know that so many of these equity discussions came to a head in this last year, year and a half. And so we'll get to kind of talk a little bit more about that later in the web conference. But for me, it was really helpful to hear about these operationalized definitions of equity, like how lived experience becomes a part of your hiring and pay practices and decisions. So, and I hope that our audience, and I'm sure that our audience is finding that helpful too. And so the last question I wanted to pose to you before we kind of open up the discussion a little bit more is just reflecting on some of these internal processes and practices that you all are changing or addressing in this moment. What lessons have you learned along the way, and what were some of those benchmarks or milestones of success for you? How did you know you were on the right track?
Absolutely. So I think some of the lessons that we've learned have had to involve, learning to come back to things and revisit them, to accept sometimes it takes multiple conversations with funders. Sometimes even when we think we're doing something really exceptional in terms of our changes, we have to make it sustainable and we have to make it in slower bites sometimes than we would want. We have to hear from our staff in the field and survivors around what we're choosing. It took us a lot of time to build out some of the things that we've included: expanded healthcare, a better plan that includes mental health coverage and HIV medications was a multi-step process. And as we built that process out, we had to hear from staff that we excluded someone or how it still wasn't as affordable as we want. It's a process that we're continuing to work on. And I think it takes a certain kind of team and a certain level of support and awareness to know that in our process of really fighting for these things, we open up spaces for people to tell us how far we haven't gotten yet, and making sure that that's a conversation that we can hear while honoring that we are working really hard. We've gotten further, we're doing better, and we're still not at a resting place, that we have to continue expanding these things and improving these conditions because we set the tone for the field.
Absolutely. And what comes through there for me is that you're recognizing that so many of the folks that you serve and work alongside are dealing with crisis, and there's such urgency in this work. And at the same time, we can't let urgency be in conflict with humility and reflection on how the practices within our organizations can ripple out. And so just really helpful to hear about emphasizing sustainability by working with your staff to ensure that they can provide for the community that you all serve. So really grateful that you shared all of that, Lisa. And again, in summary, I just wanted to go back to these technical packages to show how the Michigan Coalition to End Domestic and Sexual Violence's work aligns with the strategies outlined in CDC's violence prevention tech packages, specifically promoting social norms that protect against violence, strengthening economic supports for women and families, and finally establishing and consistently applying workplace policies. And so we will get to hear more from Lisa. Lisa, thank you so much I just have to say it that Lisa stepped in last minute, got the email from Lisa this morning. Lisa, you are amazing, and we're so grateful for you and your organization. And so I'm going to turn really quickly to Tori and Ashley just to see what's coming up in the chat.
Thanks, Will. I think a lot of people were kind of in sponge mode, just like soaking in everything that that Lisa was sharing. I know, some folks are talking about hiring health equity coordinators, hiring consultants to help them work on facilitating internal organization change. Someone had mentioned that a commissioner passed a resolution adopting a formal equity and inclusion action plan to address racism as a public health and public safety crisis. I know we've seen quite a bit of that in the last couple of years. And I want to uplift something that someone had said in response to the previous question about movements that they were working with, but I think also applies here, that folks were identifying Black Lives Matter as one of the movements that they work with or would want to work with. So I just want to thank folks bringing that up in the chat. I know there's just been a lot of gratitude for what Lisa shared and how validating it feels to kind of hear about some of those pay and benefit equity strategies that Lisa was talking about.
Excellent. Thank you, Tori. So we're going to pivot now to a discussion just on these two questions you see here on the slide, and we want to open it up to any questions coming in the text chat as well. And so as those additional questions come in, Shamila, I wanted to ask you first, how have the COVID-19 pandemic and racial justice movement of the past year and a half impacted your work?
Yeah, so I think I addressed a little bit about how the pandemic has influenced and impacted service workers specifically. What we've seen actually has been an interesting phenomenon from employers. So we had a small association with a couple hundred progressive restaurant owners, as I mentioned, that I actually used to lead prior to my role as communications director, called RAISE, Restaurants Advancing Industry Standards in Employment is the acronym. And these are all restaurants who are committed to taking the high road to profitability rather than the low road, which we see a lot of corporate restaurant chains like Darden, which is a parent company of Olive Garden and Red Lobster and Capital Grill, and other restaurant conglomerates really who are lobbying and putting millions of dollars each year to keeping workers' wages low, keeping protections against workers like anti-sexual harassment trainings and paid sick leave and other worker benefits, really non-starters as far as policy at the federal level. And so we have this really interesting distinction and juxtaposition. So we know that the restaurant industry is not a monolith. When we just say like, oh, restaurant owner employers, like who is that? Do you mean small independent restaurants who are trying to do the right thing by their workers? Or do you mean these large corporations? I think it's really important to differentiate the two. And we've seen some of these business owners make incredible strides in the last year who are committing to improving wages, improving their conditions for their workers as a result of the pandemic, because we've seen a massive, what has been dubbed by the media, labor shortage in the restaurant industry, but we know it's actually a shortage of good paying jobs and of fair wages. So we've seen hundreds of employers coming to us saying like, we want to move to the high road. We want to adopt these fair business practices. We just don't know how. So that was part of the reasoning for creating high road kitchens and this how-to. We recently also launched a how-to guide for showing employers literally how to move to the high road. It's a training and technical assistance program that includes comprehensive kind of like HR policies and anti-sexual harassment trainings, which they might not have an internal HR because they're not Darden. So they might have one person who kind of does it all. And so we're giving them a how-to guide based on a lot of research we did with Futures Without Violence and toolkits that we've put together, because you have to realize the anti-sexual harassment trainings that are, utilized by major companies, not just like in the restaurant industry, but beyond, at workplaces, offices, kind of standard, traditional, how one might consider a traditional office setting, is not going to be the same sexual harassment training that's effective in restaurants. It's not going to be kind of like a real life, maybe like bystander prevention training or intervention training. It's not going to have kind of like the quick response times that you need. Sometimes there is no HR. So how do you report a sexual harassment claim to HR if your restaurant doesn't have an HR department? Or even worse, if your manager is the one doing the harassing, right? How do you report it against your manager if he's the one or she is the one doing the harassing? So I think just the shift that we've seen from workers needing help. We launched our emergency relief fund, which we had over 300,000 workers apply. We raised $28 million. So workers needing assistance and employers needing assistance beyond just, federal government funding, but really training and technical assistance in order to improve their practices. We've seen just a tidal wave of employers moving in this direction. What would have taken us years to accrue the list that we have in the last year of employers coming to us for help, it took like a few months during COVID. So I think those are two big things that we've seen in the last year.
Thank you. Super helpful to hear about that. I'm just going to poach a phrase I heard in there as a segue into wanting to hear, Lisa, your response to this question as well. It's just this idea of a traditional office. And I know that Lisa, when all of a sudden some workers are identified as an essential worker, some workers are more impacted than other workers by shelter-in-place orders or have the opportunity to work from home or not. Can you talk a little bit about how during the pandemic and the duality also of racial justice uprisings and protests over the last year and a half, what that looked like for the coalition?
Yes, absolutely. I think it was a really interesting year for us and probably some of my sibling coalitions that do both direct service work and membership supports, training, technical assistance work that is less directly impacted with survivors. So we as an organization have worked really hard to diversify over the last 5 years, and we've become a majority BIPOC organization. We're almost at 50% LGBTQI plus, and we're about 1/3 folks with disabilities at our organization. And so we had lots of plans in place on how we can support and sustain that growth and be mindful about equity and opportunity and resourcing for our increasingly diversifying staff. And then COVID arrived, and lots of our plans and strategies became less intentional and more ad hoc than what we would ever want for the environment that we were trying to build. And one of the things that happened in that process is when we had to shut down for a sustained window of time in terms of some of our services, we had some funders that said, we don't support staff coming into the office at all. We don't see a reason why folks would have to come in, and that's not in line with like public health objectives and other things we're funding you for. And then we had other funders who were funding our direct service work that said all people who are providing direct services to survivors are required to report to work so that they can provide those services to survivors. We can't make an exemption exclusively for coalition staff. They also have to report to work. And it started to create a lot of challenges in how we created equity and opportunity amongst our staff. And that was then exacerbated as we went further into the pandemic, as Michigan had the National Guard deployed in Lansing, where our hotlines are operated out of. We had to find solutions that were equitable and really spend time listening to staff and hearing from staff, which was an additional emotional burden on what would improve circumstances that wasn't having them work from home. It included adjusted shifts. It included having drivers paid that would bring people to and from work so that they weren't concerned about being pulled over or having their movements unnecessarily policed. And so there were lots of things that those were not an original component of what we planned on working on for equity and inclusion for our staff, but became really essential. And we're still working on outcomes from that differential funding guidance that has impacted how our staff engage with one another and how they feel about the work that they do.
I can imagine anyone listening right now who has done any form or semblance of equity work, Lisa's just vigorously nodding their head, hearing about how sometimes you have to pivot and you have to pause and you have to listen to your staff, to your colleagues, to your stakeholders. And so to hear that example is really powerful. I'm grateful for the work that you do. I wanted to ask another question, Lisa, just really about what advice or resources you can offer to today's participants trying to integrate health equity values and strategies into their goals for gender justice and prevention of sexual violence. And with a specific request to describe how your internal work on hourly wages has expanded into this truly impactful, impressive systems change that you're seeing.
Yeah, absolutely. So I think part of it for us was really making sure everything that we do internally is always built with the intention that it is something that we'll be presenting to funders, to our members, to their boards. Nothing that we do internally is ever designed solely for the benefit. Of course, I wanted to benefit our team. I want my colleagues to have the best possible work environment to do the really essential work that they're doing. But it's not only to support our own critical work internally as like a microcosm to ourselves. Everything that we do, every time we do it, is designed that whatever HR tool we're building is going to be provided to our membership, to their boards, to other folks as a model to be used. And so every step of this process of increasing our wages was intentionally done as part of a process to show there's a different way to fund this work. What do we know about advocates who are in this field long term? It's not just that they're here because they don't care about what they make. Obviously, no one goes into doing social work or survivor services to get rich, but people also need to live. We're seeing a drain from the field constantly of folks who have been here. I started as kind of a late millennial, and there was a period where I looked around and only 5 or so people who started with me were still here, because when it came time to buy a home or have a family or to have healthcare needs addressed, they left for jobs that paid more, that provided more sustainable things. That drain on our field is expensive. The drain and lack of diversity by not offering solid benefits and these other components are really impactful on the diversity that we're seeing, the solutions that come to our field, the representation and ways that we meet survivor needs are directly related to how we fund and source our staff and our teams and our ability to meet their needs of what they're looking for in a job. And so making sure that we are thinking about when we're doing those things, we put those things forward to member programs, to their boards and to funders as having a longer term, more sustainable advocate, an advocacy team that is richer and deeper, even if that means instead of 8 part-time advocates, I only have 5 full-time advocates, but they are a team that's going to stay for a long time. They are a team that have rich and diverse experiences, and they bring more capacity to the work over time. Then that's the model that we want to tend towards, instead of this version where we overextend and under-resource advocates until they burn out. Our advocates are our greatest, like our dollars that we spend on salary are the greatest thing that we have in our field. It's our highest expense, and they're not kind of a refund, like a reusable resource. We can't just keep using advocates up, burning them out and replacing them with new ones. It's costly, it's expensive, and it's not in line with our values.
People are finding the reactions, the Zoom features. I'm seeing some claps, some celebrations. So yes, I'm sure if everyone unmuted, there would be an uproarious applause right now. Thank you so much for that, Lisa. And if I'm not mistaken, the increased hourly wage that you all have implemented, you're seeing that ripple through some of the membership organizations too. And so that's kind of what I'm describing as like internal organizational change transforming into true systems change, where all of a sudden it becomes a practice in the field or becomes a statute by some mandate. So it's really amazing to see that. Wanting to pivot, Shamila, any advice, resources you'd like to share here?
Yeah, and I also realized that I only answered half of the question. I just talked about COVID and I didn't talk about the racial justice movement and the impacts. And I think it's important to tie it in because I mentioned it very briefly up top, and it looks like we have a minute on the program to just bring us back to the real reason why we have sub-minimum wages in America. As I mentioned, it's a direct legacy of slavery. At emancipation, the restaurant lobby back then sought to hire newly freed slaves, not pay them anything, and have them live entirely off of tips, which was a mutation of the original concept of tips, which was meant to be a bonus on top of wages, not a wage replacement. And that has evolved from a $0 minimum wage at emancipation to, like I said, $2.13 at the federal level. Why am I giving you a history lesson? It's important to note that these vestiges of slavery still have rippling effects in our economy today, and result in disproportionately women, people of color, immigrants having less access, less power, and less say at their workplaces. And so I think in the last year and a half, with the murder of George Floyd and the large global uprising for racial justice, a lot of the small business high road restaurant owners that I mentioned that were wanting to adopt maybe some progressive practices anyways, really came to an understanding and realization that they don't want to have this literal vestige of slavery reflected in their everyday business model and business practices. So that was another kind of catalyst for change that we saw in the restaurant industry as people were getting educating themselves on these systems that exist in the restaurant industry. They wanted to do away with these mutated notions that have existed in our economy for so long. And so I just wanted to highlight that was another reason why we've seen tremendous growth of small business employers and really consumer support. And you're all consumers, all 262 of you, I imagine, go out to eat in your day-to-day practice. And so there's so many things you can do. You can first start by visiting onefairwage.org/take-action, where you can find all sorts of ways to call your senator. The Raise the Wage Act, I haven't talked too much about this, but we actually have a once-in-a-lifetime opportunity right now to eradicate the legacy of slavery, source of sexual harassment for so many women again at work. This year, as part of the Raise the Wage Act, which didn't make it into the American Rescue Plan as we had originally intended, but still has a real standing chance. It passed through Congress and the House of Representatives 2 years ago in 2019 and has strong support in the Democratic majority. There are 8 holdout senators. So specifically, I saw some of you in the chat in Arizona, in New Hampshire, in Maine. If you live in places where your senators voted no on the Raise the Wage Act, and you can find that out on our website again by going to onefairwage.org/take-action. You can call your senators. You can let them know that you support full fair wages for restaurant workers and you want to eradicate this legacy of slavery and source of sexual harassment for so many women. You can find cards that you can download that you can use while you're dining out, and you can find other ways to get involved with campaigns locally where you are. So that's a really good place to start. And then for restaurant employers, highroadrestaurants.org has a comprehensive guide, as I mentioned, how to transition to one fair wage, and lots of anti-sexual harassment trainings and resources. So a lot of great resources on our end. And I'm also happy to drop my email in the chat if anybody has any questions about anything that I presented on today.
Oh my gosh, Shamila is about to get 293 emails right after this. We're getting short on time here, so I wanted to do something kind of special, which is just to invite one of our participants to come off mute. Ray Romberg is actually on the line right now, was also featured in the report, and specifically wanted to hear about Ray and the Alaska Network on Domestic Violence and Sexual Assault's journey, implementing health equity strategies, just to briefly kind of like get another perspective and some additional insights. So Ray, you all set out on a path to partner for an economic justice campaign, sort of like what we're hearing both of these other examples talk about, and encountered some curves in the road. And we'd love to just hear a little bit about your story of integrating health equity values and strategies into your work, and how your organization is prioritizing health equity now.
Great, thanks so much, Will. Hi, everyone. I'm Ray. Like Will said, I'm here on the unceded territory of the Tlingit people in what's now known as Juneau, and I am the prevention director at the Alaska Network. I use they, them pronouns. And when initially approached to be included in this awesome document, this awesome paper, I emailed back and said, well, our story is a little bit messy. The awesome initiative that we had started has actually stalled. So the work that you all were interested in, that is reflected in this photo from a Lilly Ledbetter celebration at the state capitol, was sort of stalled out, had taken a pause. And so what the story there is that we at the network were pushed and inspired to move towards working in the area of the gender wage gap because of the opportunity with Delta funding And so we looked around for a partner to see who in the state was working in this area already, of strengthening economic supports, and found a pretty natural partner in the YWCA of Alaska. Their goal to eliminate racism and empower women, promote peace and justice really aligned with ours. And they had a robust and very ambitious project called Econ Equity, which sought to end the gender wage gap in Alaska by 2025. So in Alaska, our wage gap is in 2017, the best numbers we have was higher than it was in the rest of the state, with Alaskan women only making 68 cents on the dollar. And so both CDC technical packages tie gender inequity and wage inequity to domestic and sexual violence, and it just seemed like a really natural partnership. And also, Econ Equity was working to really engage the business community, which seemed like an exciting way to go with new partnerships in the business world, and looking at economic justice is not so much a social issue, but as a business issue. So that was really the approach they were taking, trying to sell it as good business sense to take a survey and look at have a business take a survey, look at their own gender gap, and then make commitments to make changes. So we were bringing our network of 21 member programs to the table to partner with the YWCA and spread their initiative outside of Anchorage. It was really centered in our biggest urban city. And we were so inspired and excited. The executive director at the time was sort of the founder of this initiative. And we started on a path to align our work and made great plans. And then that ED left. And we quickly realized that inspiration and that excitement for this initiative lived with that one person. And it was not well integrated into the YWCA, nor other partners around the state. So we learned a very valuable lesson about putting kind of all of our eggs in one basket, so to speak, and also getting caught up in the excitement of a personality as opposed to investigating more thoroughly the partnership. We also kind of ignored, ironically, a red flag in the relationship, which was that Econ Equity chose very specifically to not address the racial disparities of the wage gap in Alaska, and really just focus on the gender disparity, which we talked about, but then quickly moved on at our agency, which is a primarily white agency. And so it was fairly easy to let that go. Whereas I think had we been working more closely with some of our Alaska Native partners, it would have been clear that that was a problem, because as you can imagine, the disparity mirrors that of the disparity around the state, that it's not just the gender gap, but it's also the racial gap that is problematic. And it's higher for Alaska Native women than it is for white women in the state. So it has caused us to take a pause and try and learn from what happened, and also build stronger and more diverse partnerships to figure out how we can still work on the issue of maybe not gender wage gap necessarily, but the issue of economic inequities in our state, to work to end domestic and sexual violence. And I just so appreciate this document and the approaches that you all took in terms of community focus and healing connectedness, because that's actually sort of the direction we've ended up going, is going into communities and asking for input about what economically would make a difference in community, and also acknowledging that there is a lot of healing and that we're hearing about that needs to happen, that cannot be pulled apart from even the economic work that we are hoping to do. So just very honored to be a part of this conversation and share some of our missteps and the incredible learning we've been doing here in Alaska.
Well, thank you so much, Ray. I promise to our audience I did not script out that glowing review of the report, but Ray, I think we're just also grateful that you shared, and I think your reflections on these complexities, on complexities of inequities, racial, gender, and otherwise, and just seeing how deflated these efforts can be when all of a sudden there's a departure of an individual, a key leader. And so kind of like Lisa was saying, finding ways to integrate these values into organizational practices so that it, like you said, Ray, it's not all of our eggs in one basket type situation. So grateful for you, Ray. So grateful for the Alaska Network. We are running out of time because there's just so much to touch on in this amazing web conference. We have about 3 minutes here. What I will do is we will go through some slides that just show some of the resources that you have heard described. And while we're doing that, we will share these slides out as well so everyone can revisit them on your own. Tori, are there any kind of final thoughts or big questions coming up in the chat that you wanted to share before we close out?
I think our speakers did a wonderful job of answering those questions as they came out. There is a lot of gratitude in the chat for Ray, for your vulnerability and honesty, and really uplifting the need to, when we address economic justice, it's racial justice, it's gender justice. It's not just one of those things. So folks are really grateful for your honesty and vulnerability and sharing that with us.
Yes, the chat is just, there's so much going on in there. Just a testament to the intersectional piece of this work being such a fervent, energizing place for all of us to sit right now. So grateful for everyone joining. So grateful for all of our guest speakers, our collaborators who helped pull this together. And I think we have some emails on this slide for anyone who wants to reach out. All of our guest speakers have agreed to just be a resource, be available. We want to continue building our network. We're so honored to be in this work with all of our guest speakers, with all of our audience today. So just a final thank you, be safe, be well to everyone, and looking forward to the next time.
Thank you all so much for organizing, and thanks everybody for tuning in and participating so actively. It's great to see you all.
Yes, thank you, Shamila. Thank you, Lisa. Thank you, Ray. Thank you, Will, Zach, and Lisa over at Prevention Institute, and Jen at the National Sexual Violence Resource Center. Thank you to my colleague, Ashley Klein-Jimenez, and to our friends over at Aberdeen Captioning. This will conclude the web conference for today. Keep an eye out on your emails for a survey coming soon and a link to a recording coming in the next week. Take care, everyone. Wishing you all safety and hope and healing, and thank you for joining.